Hello everyone. So today we will see a mnemonic for the examples of dimorphic fungi and their common names. So starting with the mnemonic HSBC P square. Now it's not very difficult to remember this. You must have heard of the bank HSBC bank. So just like that, remember it in sequence HSBC and P square for the two P's. Now these are the six very important examples which are often asked, and along with their common names, which I will be mentioning for few of them. So starting with the first one, H is for histoplasma capsulatum, right? The next S is for Sporothrix senkai. The next B is for Blastomyces dermatitidis. Then the next C is for Coccidioides immitis. Then the first P is for Parakoxidis brasiliensis. Then this P is for Penicillium marnifi. Now the name has been changed to Plastomyces. So these are the six examples. Once again, the mnemonic is HSBC P square, where H for histoplasma capsulatum, S for Sporothrix senkai, B for Blastomyces dermatitidis, C for Coccidioides immitis, then P for Parakoxidis brasiliensis, and P for Penicillium marnifi. It's not very difficult to remember. Just write it down once or twice in your own and see if it works. And after writing it once or twice, you will most probably remember it. These last words are a bit difficult, but with practice and proper revision, you will get it. So now, some common names for all of these which are often asked. So starting with the first one, histoplasma capsulatum. Now, histoplasma capsulatum is also known as Darling disease or Cave's disease. So how to remember this? Okay, first I will write down the common names for all of these, and then I'll tell you the mnemonics at once. So the next is Sporothrix senkai. So it causes sporotrichosis, and that is known as rose thorn or rose cardinal disease. Then Blastomyces causes Blastomycosis, and the common name is North American Blastomycosis, or it is known as Gilchrist disease. The next is Coccidioides immitis. It causes Coccidiomycosis, and it is known as desert valley sorry desert rheumatism, or it is known as valley fever. Then the next is Parakoxidis. It causes Parakoxidomycosis, and the common name is South American Blastomycosis. So now how to remember this? So histoplasma So remember, his darling is in cave. His darling is in cave. So histoplasmosis is also known as darling disease or cave disease. Then coming to sporophytic senkai. Now here you can see spores, and this disease is a typical of the rose gardener who are picking up the thorns, and due to minor trauma, due to these thorn injuries, they develop this porotrichosis. So you can just remember like spores are related to the roses. Then coming to Blastomyces. Okay, let us first see this coccidoides. So it's very simple. Just remember C and D. CD. So C for coccidomycosis and D for desert rheumatism. And desert valley, all are the same thing. Desert valley. So C for coccidoides, D for desert or valley. Then coming to blastomycosis. So here remember G and B. Now if you have watched How I Met Your Mother series, this is for Goliath National Bank. But now here G is for, okay, B is for Blastomyces. B is for Blastomyces. This N is for North American Blastomycosis and G is for Gilchrist disease. So G and B, Gilchrist, North American and Blastomycosis. Right. So now Blastomyces is the North American. So what is left? The Parakoxidis. So Parakoxidomycosis is known as South American Blastomycosis. Okay, I hope you have understood now. So let's quickly see what was Darling disease, what was North American Blastomycosis, what was Gilchrist disease, what was valley fever, and what was rose thorn disease. Okay, I am very sure you can easily recall each one of them now. So just to complete this, his darling is in cave. So this is histoplasmosis. That is histoplasma capsulatum. The first H in our HSBC P square. Now the North American, I told you G and B. So G Gilchrist, N North American and B for Blastomycosis. So these both are for Blastomycosis, which is caused by Blastomyces dermatitis. Then valley fever, I told you CD, so desert and valley. C for coccidoides immitis. Then rose thorn, I told you this is a typical clinical history. This is in sporotrichosis. So I hope this small video was helpful for you. So that's it for today. Thank you very much for watching.